morning, everyone. Happy Friday. You might hear my computer fan is going off and also my washing machine. Ignore that. So today for Lam meNOTpause series, we are talking perimenopause, all things perimenopause. But today we're also talking about heavy bleeding, menstrual cycle, from girls to women. And I have a very special guest today, Dr. Talat from Sydney, and she is one of my meNOTpause gang. She is a super clever woman. She's the director of Women's Health Road, which she founded. She is a gynecologist specialist in heavy bleeding and menstrual cycle for women. And she is also the founder of Bleed Better. And she created International Heavy Menstrual Bleeding Day, which is coming up soon in May. So she is a clever one. And for those of you who ask me, how the hell did I manage to get into this gang? I have no idea. So I like to surround myself with very clever people to educate myself, and that's how you grow. So don't mind being the silly one in the group, because then you can ask questions, all of that. So I'll tell you a little bit about Dr. Talat. She is a gynecologist, and she is very experienced in the area of menstrual cycle, and she is a big advocate for women's health and heavy bleeding, how to resolve the problem, and how to help women, which is very important. And I want to make sure that she is on here. Thank you for tuning in, everyone. I'm just waiting for Dr. Talat, and let me send her an invite. And as you know, if it doesn't work, it's because Instagram is racist towards me and is never my friend. So let me try to send her a message now. And please go and follow Women's Health Road and also Bleed Better. Women's Health Road. And I will also Women's Health. Fingers crossed. If you see me doing my Success Connection dance, that means we're in. I can see her just join.
Hello, we are live.
That was less painful than I thought. How are you,
Thankfully, have
Dr.
a
Talat?
teenage daughter. How are you, Grace?
I am just glad that it's Friday and my husband is returning from Perth. He's been away for the whole week, and single parenting is not easy.
Of course. Time to
Huge
hand
respect
over.
to single parents.
Absolutely. Hats off to them all.
Exactly. So let's talk about you today. Can you please state your full name and your age, if you don't mind? And
Of course.
also, are you going through perimenopause?
So my name is Talat Uppal. I'm 54. I would love to say I'm going through perimenopause, but I am actually on the other side. As in, I'm postmenopausal now, so Grace, but I did have an interesting perimenopause journey in terms of because I had medical menopause, so then it was quite sudden for me.
Wow. What age did
I
you go
was
through that?
49. I was 49, and also because I'm Southeast Asian background, generally our menopause tends to be a little bit earlier when we look at national averages. There's not a lot of data, but what research we do have shows that it is earlier compared to, for example, Australian-born women who have a national average of around 51. So some data from India shows that it's actually more around 46, 47 for our backgrounds.
Wow, that's pretty
Mm.
early, yeah? So what were your symptoms?
So for me, my symptoms were mostly around hot flushes, some degree of brain fog, and also some irregularity of the cycles, which was actually rather sudden. So I didn't have some of those, protracted leading up to menopause sort of different sort of patterns that many women endure. So in some ways, it was good because it was actually, managed in a more sudden non-rapid way. But in other ways, I think the insidious onset allows us time to actually find more solutions. And thankfully now, Grace, there's more attention, more awareness, and certainly more recognition that we need support during this journey.
And did you take HRT straight away?
So no, not straight away, but eventually I did. And I think a lot of us initially trial other things or feel that maybe they're natural things that we can lean on. And sometimes we actually genuinely have some reservations, which are not always well founded, and they're not necessarily research founded. So it takes us time sometimes to make that journey to say, actually, you know what, this is what works better for me. And even within the same person, Grace, there's so much variation. What you respond to, say, at 52 may not be the same scenario a couple of years later because some of your symptoms might be starting to settle anyway. So it's quite a individualized space, I think.
Oh, 100%. There's no one size fits all, that's for sure. Can you tell us why you set up Bleed Better and Women's Health Road Clinic?
Thank you so much, Grace. That's a really important question. So my interest is looking after women with abnormal bleeding. And there are two main categories, Grace. One, of patients that we're privileged to see are those with heavy periods. And then there's another whole group of women who are bleeding on some form of hormones, which may be, for example, contraceptive hormones, or maybe the hormone therapy, for example. So in terms of the first group, women who are having heavy periods, this is a quarter of reproductive aged women. So think how large and how common this problem is. And I would feel quite helpless, Grace, in terms of how do we help the community? Because many times I feel that women normalize this condition. And so then I thought, look, Bleed Better as a team, we felt was a good name for a charity-based initiative to support the community because it acknowledges that the solutions may not be perfect. And so that's why we thought Bleed Better just means consider your baseline. If it can be optimized, which we feel that there's actually very good hope for many women that are suffering, then consider bleeding better. And that was the message to the community and society that we wanted to give. And
I mean, I
unfortunately,
love that name. It's so direct, and that's what I love. I love direct people and direct message because that doesn't make you guess what it is. It's straight to the point. All of us can relate at some point of our lives. When I was younger,
yes,
my menstrual cycle was very on the dot. You know, every month the same, until the first year of my perimenopause, and I basically my period was very irregular every 3 months, sometimes every 4 months, and that's when I clock it. Oh,
yes,
maybe it's menopause.
yes,
And then at one point, when my first doctor upped my dose for HRT, I
yes,
was bleeding nonstop to the point that I was so tired every day. I thought I was anemic, and then my iron level was very low, and it was so crazy. It was bleeding so heavily that I thought this is something is wrong.
yes,
So, and also two questions. Why does that happen sometimes
yes,
when you change your dosage of HRT?
yes,
And when I was in my 20s, I had a girlfriend who didn't have regular periods,
yes.
and she was told that she could never have children. She has two afterwards. So
Thankfully, that
sometimes
was
the
such
message is
a
very,
bad
yeah.
advice that's been given to so many women, isn't it? That you have zero fertility, and they thankfully don't have that situation later. Yes. So, in regards to your first question, Grace, that in terms of bleeding constantly and having irregular cycles, these are very common in perimenopause, and sadly, again, it's not always recognized for the morbidity that it causes women. And there are two main reasons. One could be structural, that is within the uterus. Like, for example, we could have polyps in the uterus. We could have adenomyosis, which is a version similar to endometriosis, but where the lining is in the muscle of the uterus. We could have in a small number of women, Grace, maybe harboring a cancer or a precancer. And also a very common contributor is fibroids, particularly if they're poking into the uterus. However, the reason why perimenopause we often deteriorate is because there's also hormonal reasons, and we're having what we call anovulatory cycles. So the cycles are spread, and when the period does come, it can come with a vengeance. And like you articulated, iron deficiency can be such an unkind space for women. And then it adds on to the miseries that we're facing through perimenopause anyway. And the saddest part is that there are not actually sad, Grace, but actually the part that I reflect on most is how many options of support there are for women, but because there isn't always the menstrual literacy or the understanding, or there's reluctance to reach out for options, then we find that often women suffer for months or years for something that is actually relatively fixable.
So for girls that just got their period, or like very young teenage girls, what should they be looking out for? Because I mean, I know this is more a menopause series, but however, every single woman, every single girl in this world is going to go through menstrual cycle and also perimenopause, menopause. So how do we prep them from a young age? What should they be looking out for? How can they self-help, and how should they talk to their mother or doctors?
Excellent question, Grace. And like you rightly said, this condition, heavy menstrual bleeding, is clustered to the extremes of reproductive life. So it can occur anytime, but particularly amongst adolescents and also amongst perimenopausal women, when the axis of reproductive health is starting, or when it is starting to taper down. So with younger women, actually, overall, this condition is called a quality of life issue. So basically, if it compromises women of their physical, if the bleeding is so excessive that it compromises physical, emotional, social, and or material. So if a young girl is not able to focus in school, is absent from studies or from sport, for example, that is affecting her quality of life, then that is heavy menstrual bleeding. So, and this can be alone, Grace, or it can be associated with other symptoms. Like, for example, half of women that bleed heavily also have some degree of pelvic pain. And so for younger girls, it's very easy for me to say, look, this is a quality of life issue, but actually they want to know what are the clues that might tell me that I'm bleeding heavily. And these can include if you're changing your sanitary protection more rapidly than 2 hourly, if you're using multiple or super tampons, or you're needing to use a tampon and a pad, if you are waking up at night, or your clothes are flooding through, or you are passing clots, or you are dizzy and tired and exhausted and just, having low energy, because these could all be the consequences of the iron deficiency that can result from heavy menstrual bleeding. And Grace, let's not underestimate the anxiety that this condition can also provoke, because it's very for young girls especially, it can be so confronting in terms of managing a period that is so heavy.
I was watching the Olympics of
Mhm.
ice skating because it's
Mhm.
such a beautiful sport. And one of the Olympians from the States, she was talking afterwards
Yes.
how she was on her period when she had to skate. And I thought, wow, to wear, the costume that they wear, which is very skimpy, right? Very thin.
Yes.
And to worry about whether you're going to bleed out so the whole world will watch you, that is not she has to perform. And like most women, whether you're a student or working woman or stay at home mom, when it comes to your period, it's a very you get very nervous and have anxiety about your heavy period days, especially the first few days.
Exactly, Grace. And we do look after a lot of sports girls in our practice at Women's Health Road, where we have set up Australia's first abnormal bleeding hub, where we say, look, we will provide that one-stop service for you in terms of not only diagnosing what might be an underlying condition, but also trying to offer you solutions and then working with you. Often, because there's so many solutions, Grace, it's best for patients to guide, or the women to actually guide the clinician and say, look, this particular one feels like the best fit. And also to have a plan A and a plan B, so that, if we think, oh, well, the first one hasn't worked as well as we were hoping to, or perhaps there've been some side effects, then we have a backup plan as well. But in response to the Olympics side of things, I 100% agree with you. And the sad part is that we're still having so much silence and taboo and shame around menstrual conditions. And that doesn't help when we're having heavy periods, because obviously they're more likely to leak. And there are so many options, including, for example, Grace, tranexamic acid, which is a tablet you can take during the heaviness of the period. I call it T for tsunami, T for tranexamic acid. There are hormonal options for younger girls, including, for example, what is popularly known as the Mirena. Many women are not aware that the levonorgestrel IUD, which has progesterone in the IUD, it in research settings reduces bleeding volume by 90% by the 4 to 6 month mark. So you can imagine that even though they might get more spotting or irregular cycles, particularly at the beginning, the tap is almost turned off for many, many women. So that awareness of which agent is more likely to work for this condition is really important for us to support and educate the society so that they are aware of any, because otherwise it's lost opportunities, Grace, really.
So what happens to young girls when they just start a period and it's very heavy? Is it suitable to put a Mirena then? Or was Mirena for a certain age group?
So often, Grace, I'm guided by the young girl. Sometimes the parents have lots of opinions as well that are supporting the child. And in different contexts, obviously care is very individualized. And usually we start with tranexamic acid and some sort of hormonal support. But yes, many, many women, because of the degree of bleeding that they're having, and at some point, some are not necessarily the 13-year-old, but there might be some that will be embarking on sexual activity with heterosexual relationships. So there might be that angle as well, that how do we support them with contraception? So yes, we do put quite a few Mirenas in our practice in teenagers and also in 13-year-olds, where we have had children who have not been able to go to school for weeks because they are just bleeding torrentially. And so then, these are the support systems that are available in individualized cases. But in general, we do try and see if we can offer oral options as well, and basically support the person in what they think is the best first step to do together.
So I've got two more questions. One before I forget with this perimenopause brain fog. So
Mm-hmm.
one question is, when a young girl comes to your clinic
Yes,
and she wants to be on medicated,
yes,
and the mom or the dad doesn't want, or vice versa, how do you deal with
yeah,
that? That's question number one.
yep,
Number two is, so after my first doctor, I changed my perimenopausal doctor to
yes.
one of our menopause gang, Dr. Sunita from Hira in
Yeah,
Perth.
it's wonderful.
And
Yes,
she immediately put me on
yes,
Slinder, and my
yes.
life was changed back to
Completely
normal
changed.
again.
Yeah,
And I
yeah,
thought, wow, isn't that crazy that when you find the right doctor to help you, it resolves all the problems and you can go back to your normal self and be all fabulous and do what you're supposed to do. It's so important not to just
yes.
soldier on, women, and everyone. So please bear that in
100%.
mind. So yes, so to my question number one, how do you
Yeah.
talk to
To
parents
your
or
first
children?
question, so the first thing is that as a clinician, our duty of care in the first instance is to our patient. It's not necessarily to all the other people around that person, but we obviously prefer if there are, if there are, so for example, if there are situations in which the person that is seeking our care is comfortable to include a support person, which could be her mom, her parent, a sister, a cousin, then of course we would welcome that, and that's the most ideal situation. You and I know, Grace, that that is not always possible or practical for many children. They do not have that relationship, or the parents have not got that, connection. And so we still need to obviously care for the person that is seeking our help. There's also the concern about when they are younger, in terms of, as always, but particularly heightened, is the concern around possible abuse and all those other factors that always exist around also consent, ability to consent. So there's this concept of mature minor. So there's a little bit of behind the scenes thinking through what would be the best way to approach this. But at the end of the day, the confidentiality of the young person is so important to uphold and to support outside these scenarios that I've mentioned. So we often try, if the person is happy to bring their mum into that discussion, I'm very, very, very much welcome that. But if it is the reverse, Grace, if they come with their mum, I always say at the end, is it okay if I get 5 minutes with her by myself? And most mothers are fine. They're like, okay, yeah, that's okay. They understand that we need to ask questions, because again, you and I and everyone knows that children will at times not tell things in front of their parents that the gynecologist really needs to know. So
Yes.
that's the first thing. And then the second thing that I was going to say is that it is good when the mother comes along, or the father, or anyone that is their primary support person, because we then end up trying to be on the same page, and it allows me to allay. Sometimes actually the younger person is actually more informed than the parents, and so it allows us to all be open and to discuss things. And sometimes things I get asked are like around fertility. You've got a 14-year-old girl, and it allows me to then say, no, this does not affect fertility. Please do not stress or worry about this. I appreciate you've seen this on social media, but I am able to diffuse some of the concerns. And regarding your second question around perimenopause, it is so critical to find the right clinician, but also sometimes it's important for us to feed back to someone who may not have served us well, because it could be a lack of education, a lack of interest, and doctors and I think healthcare providers should refer laterally. If they do not feel confident to manage perimenopause and menopause, I think that it's really important that they assist patients to find the right person, or sadly, it's often up to the woman to then negotiate and find someone that meets their needs. And Slinda, by the way, is an excellent option as well. I use it a lot. It's drospirenone. It's a progesterone-based agent. It is not registered for heavy menstrual bleeding as such, so we use it in an off-label capacity. Anecdotally, I will agree with you, Grace, that many of our patients get very good results from that.
Oh, it's been amazing. Like I just couldn't survive being like that every day, because I think I bled for like at least 3 weeks non-stop. That is
Yes.
crazy, isn't it?
Bless. That is
And
really debilitating,
oh
yes.
my God, I couldn't do anything.
And do
And then I
you?
felt so weak every day.
Yeah, it does. It does. And I think this is where sometimes women don't always connect the two things, because I often hear patients tell me things like, it's only 2 days, or it's just 3 days that I bleed heavily. And then I say, but your iron is actually quite borderline. And you're telling me you're feeling tired and exhausted. So the impact of those 2 days is most likely lingering the entire month with you. But that connection is not always very obvious, because they think it's just to soldier on during those 2 days and put some band-aids and get through that, and then I will somehow manage till the next cycle. But it's robbing you of your best quality of life often. And so such a good example, Grace, in terms of seeking care, finding the solution, not settling for substandard solutions, because there are many of them. And with perimenopausal women, Grace, we are very blessed because we have more solutions in our toolbox. Often fertility is not necessarily a primary concern. And so in that case, we can look at day surgical options like an ablation. Some women, like I mentioned, have those like what I fondly call chandeliers in the uterus, which might be a polyp, might be a fibroid, that we can then level, we can remove, we can give them confidence that they don't have a malignancy, they don't have a pre-malignancy, but also try and do some what I fondly call the medical plumbing. And so we can support them with that. And also we can combine in, for example, transdermal estrogen for suitable women, to offer them that, to say, look, would you like to manage the hot flushes side and the night sweats, the poor sleep, the brain fog, and all of that. So it can be packaged with what we're using to actually control the periods as well.
So what happens when you're low in iron? Do you just I pop a pill at that point? But
Mhm.
I understand that you can't do that too long. Or
Mhm.
is it like iron infusion you can do? So what happens when
Yes.
someone's really lack of iron?
Yes. So lack of iron obviously can be variable because it's a range, and that range is so wide, Grace. But even so many times, it's for between 30 to 200 ferritin, which is the equivalent of iron. And often when women are 31 or 32, they tell me, oh, they've been told it's normal. But imagine something that's towards the lower limit of normal, and then you're continuing to bleed on that. So that's next to no reserve. And the issue with iron, Grace, is that it's a spectrum. So we want to put brakes on early before women then proceed down that spectrum and then become, on the other side of the pendulum is anemia, and which is just progressive worsening. And so iron deficiency affects every cell in our body, literally, from all the tiredness, exhaustion, and feeling dizzy, feeling unable to do your daily tasks, to shortness of breath, etc. So the issue, we do try and offer oral, but the problem with oral sometimes is compliance. Not everybody takes it regularly. Number two, it can give some side effects, particularly constipation and gastric side effects, which then, you're trying to treat a problem and you're giving new issues. The beauty of IV infusion is that it also obviously has a small risk profile, but it is able to get that amount of reserve into the woman quickly. And then at the same time, if we can try and find answers and also close the tap or reduce the tap, then we're having three goals we're trying to manage. It's a better approach.
So what can, first of all, doctors, workplace, schools can help work for women who have heavy bleeding?
Yes. So I think the first thing is the awareness, to recognize that 1 in 4 is 25% of reproductive age women. These women, like you said, are in our schools, are in our work, they're at our sport. And so we need to be mindful and create awareness of this. And that's what Bleed Better is all about in terms of the International Heavy Menstrual Bleeding Day. Can you believe, Grace, that this common condition that is treatable, that causes so much morbidity, did not have a dedicated day? And think of all the campaigns, all of which are so important and critical, but why this wouldn't have a day was beyond me. And that's why we then said, look, let's start a day. Let all of us shout this from the rooftops to say, this is common, but it is not normal. And so I think that schools have to have policies that support women who are bleeding heavily, but also encourage them to seek the medical care. And the medical care, I think, as a health system, as a public health policy, needs to recognize this as an important medical issue, which unfortunately, Grace, I don't know how to put this tactfully, it has been lacking. It has not had the funding it needs, has not had the critical attention at a government level, at a strategic level, to be able to, and thankfully we're getting that for endometriosis, we're getting that for menopause now. We're starting to have those conversations and discussions, but heavy menstrual bleeding needs to be included in that list, and all of which are important.
Don't worry, I'm going to attack Health Minister, Mr. Mark Butler, again and again, and Rebecca
Thank
White,
you.
Deputy Health Minister. So they do check
Thank
my
you.
Instagram because I've bombarded them long enough.
Bless,
So I will
bless.
make sure that they can see it. And what was I going to say? Brain fart moment. Yes. I want to suggest something for women.
Mhm.
So I stopped using any kind of period products like pads or tampons for at least 7 years because I was introduced to Moon Cup, and then I started
Oh,
using while I was living in Hong Kong. But then I realized the
right.
Moon Cup leaks quite often. It doesn't hold
The
the liquid
volume.
so well.
Mhm.
So someone, a girlfriend of mine, gifted me a disc cup, which is round and it's like a disc shape, and that has saved my life. And I've been using it for
Wow.
7 years. It's basically the brand that I use is called Nixit. It's from Canada, but there are so
Right.
many Australian brands, and it just comes in like a disc like this, and you insert it, and
Right.
it saved my life. So I highly recommend because it saved me so much money. Like I use that, you can use that for 10 years basically. So I've used it
Wow.
for 7 years. I haven't bought one single period product, since then,
Amazing.
and it's very easy to use. And when I need to go out to meetings or out and about, I don't need to change anything. I don't need to do anything. It's
That
amazing.
would certainly simplify your life, wouldn't it?
Yes, exactly. You just have to time it a little bit better when you
Yep.
need to change it. But it really, if there's a fire, that's that cup and my HRT are the first thing I'm going to grab
Bless.
before my husband and my son because they have
I
legs.
love the prioritization.
Yes, exactly. So definitely check it out.
Yeah.
So I know you're very busy today. The last question I have is I want to talk about the special date that you've set up. It's the
Mhm.
11th of May. Heavy Menstrual Bleeding Day, which is amazing. And what message shall we share to the world about this?
Don't settle for a quality of life that is mediocre. You deserve a good quality of life. Do not let heavy periods rob you of that. There is a lot we can do. We're here to care for you. Please reach out.
And for those of you who don't know, please follow Bleed Heavy and also Women's Health Road Clinic. And you can find them on Instagram or website. And I really want to say thank you so much, Dr. Talat, for your time, all the hard work you've done for women. And we need more doctors like you.
Thank you, Grace. I'm very humbled and very grateful for this opportunity to connect with a legend like you. It's so good to connect advocates for women's health. We really need to do better.
I love surrounding myself with clever women like you. You know, I don't mind being the silly one because I learn so much. And please, I would
Thank
love
you.
to invite you to come back and talk more about this because once this is out, I'm sure we'll get loads of questions and then we definitely need you to come back and educate us more.
I'll be hugely, hugely interested in doing that. Thank you, Grace.
Amazing. Have a good weekend. And I'm going to try and save this. Wish me luck. And I
You
will
too.
tag you. And anyone's got any questions for Dr. Talat, please message us, DM her, and we will
Absolutely.
definitely talk soon.
Thank you very much, everyone. Bye.
Thank you. Bye.